This week ends the cervical care. This week ends Cervical Cancer Awareness Month, but OSF's work to treat the disease is just getting started. Here's Dr. Michelle Rowland. She's a gynecological oncologist with OSF Cancer Institute, and she's telling us that there's some hopeful news. Good morning, doctor.
Good morning.
Now, before we dive into everything, can you give us a little background information about cervical cancer and who's most affected?
Yeah, so cervical cancer is a cancer that involves the entrance or the base of the uterus, and so any woman who has a cervix is at risk for cervical cancer.
And there's an active study at OSF Cancer Institute this is all involved in. So tell us a little bit about that.
Yeah, so this is a study for women who have been diagnosed with cervix cancer and have a recurrence of that. We have an approval for a drug that came in 2024 called Tivdak. That drug has shown dramatic improvement in helping women with that disorder. However, we know that it has eye side effects, and so we are working with a number of centers across the country and locally here with Illinois Eye Center to figure out how best to protect women's eyes while they get this great treatment.
When you say there are side effects for the eyes for Tivdak, what kind of side effects do people see for their eyes?
Yeah, so it can be as simple as just dry eye, but it can actually progress to blindness.
Oh my goodness. Yes, no wonder you need to get a trial in the works for that.
Yeah.
Now, I understand there's actually another trial coming up as well.
Yeah, so we have another national trial coming, which we know for women who require radiation for first treatment of cervical cancer. So this is women with an initial diagnosis where we say they need radiation, that adding immunotherapy to that improves their outcomes, and adding chemotherapy to that improves their outcomes. But now we're looking at how do we use those together or separately? What's the optimal treatment for these women?
Right, what's the optimal combination of A, B, and C, basically?
Exactly.
Do you leave out C? Do you leave out A? Very interesting. Now, what red flags should people know about when it comes to cervical cancer?
Yeah, so most important to know that early cervix cancer often has no symptoms, so we encourage people to get their regular screenings. But if you ever have new vaginal bleeding that's irregular, something changed about it, new vaginal discharge, or new pelvic pain, those would be warning signs that they should see their doctor.
Thank you so much for coming on the show, Dr. Rowland. This is absolutely fascinating stuff, and we'll have those details on our website. That's 25newsnow.com, and another half hour of 25 News Good Morning is only minutes away. We'll be back in just a little bit.